at 9. This is a live stream, so you'll see the meeting is starting to be live streamed. So for situational awareness for those who are new joining us, and we will go through some very specific pieces of our meeting before we transition to our guest presenters today. So thank you everybody for joining us early this morning.
Okay, sorry.
Everybody's enjoying the spring weather today. I am not going to get any rain. I am on the western half of the state, so we're about as dry as you can get. But I am very excited for those who might be getting a little sprinkled today, but no bad weather coming along with it. So I will wish that. Everybody continuing to join. We're going to have a nice round group today. As I shared a moment ago, thank you to all of our home visiting friends who are joining. Our meeting is live streamed. So, and we have already started the live streamed. And so just for situational awareness, we will take care of some panel business to start off with before we transition to our home visiting presentation. But thank you all for joining early and being a part of the panel this morning as we get started here in a few minutes. We will start right at 9 as soon as we continue to let a few more folks in. Heather, was your event and your meeting just great this week? So jealous. I'm so jealous I didn't get to go on Wednesday.
They both were. We had a lot of fun. Thanks for asking.
Yes. Are you glad? You're probably exhausted after all of that.
Yeah, I got exhausted.
Good exhausted. I think we all have enjoyed celebrating Brenda's footprint within the early childhood space. So. Okay, Lindsay, let's go ahead and get started. Okay, good morning. My name is Melissa Schoenberger, and I am the chair of the recommendations panel, and I welcome you on this Friday, April 17th, to our live virtual meeting. I want to remind everybody who is joining us on our live stream and who are joining us and today, and to our panel members, that today is a remote meeting, and we will use the raise hand feature when we have questions or comments, and we do ask that everybody introduce themselves. We do follow the Open Meetings Act, so we will not be using our chat. If I do note that there's any questions that get dropped into our chat feature, I will make sure and bring those up so that everybody has the ability to hear and be a part of the conversation. So again, welcome everybody to today's panel meeting. For those who are new to our space and joining us, the Early Child Recommendations Panel serves as an advisory group to the Kansas Children's Cabinet. So we will put forth ideas, recommendations, new thoughts, and making sure that we all are in line with the All In for Kansas Kids strategic plan. And we really try to use the panel as a place for conversation to challenge the early childhood ecosystem to be better. So welcome again. Now we're going to take care of business. These are the first 3 minutes of formal work within the panel. So we're going to go straight into the approval of the April agenda that was sent out to everybody. And as I shared, we're going to, take care of our business. So if we can have somebody who they were sent out on Monday. So I hope everybody had a chance to review them. And if I could get a panel member to make a motion to approve our agenda, I would greatly appreciate that.
Janelle Dean and I approve the agenda.
Thank you, Janelle. Can I get a second?
Marita
This is
Salpina.
Madeline McCoy.
Okay, we will capture Marita as the formal second to that motion. And if I can have everybody who agrees with adopting the agenda, have a thumbs up, hands up. Love the high fives. Feel like they're all virtual high fives to a very formal approval. And then if we could have the same sign for those who possibly disagree. The motion passes. And you were also sent our March minutes. And if I can get a motion to approve those March minutes, please.
This is Trina Morgan. I move that we approve the March minutes.
Thank you, Trina. If I can get a second.
This is Tammy Benham, I second.
Thank you. Can I get a hands up or thumbs up for adopting the March minutes? Okay, I see that is unanimous. So we will accept the March minutes as presented. Lindsay, if we could go back to our agenda. Just want to give everybody an overview of what we're going to do today. We're going to do our panel introductions. We're going to have Kansas in the news. We're going to have our home visiting showcase, which I'm really excited for today. Again, and then we will segue to our work groups and really, again, also excited to hear your updates. Some system updates that Lindsay's going to share with us. Then we'll end with key takeaways. And then, of course, we will have an opportunity for breakout sessions for our work groups. So let's just really dig into the morning and move forward. Okay, we're going to have panel introductions, and we know already that we have one panel member who won't be with us today, so we're going to ask for a volunteer as we move down, but please keep your introductions to a minute each, and we will start with Larry Lewis. I feel like the price is right. Like, Larry Lewis, come on down and then introduce yourself. Is Larry not with us today?
I think I'm only seeing currently, although we have more people joining as we speak, Christina and Mandy, pardon me.
Oh, okay. So let's start with Christina.
Sorry. Okay, hi, I am Christina Small. I am the executive director at Salina Area United Way. I've been in my role for about 2 years. Prior to that, I was the early child care initiative director here at United Way when we took on the child care crisis in Saline County. We have been doing our early child care initiative since 2023. Since then, we've granted out almost $1 million to child care centers and in-home providers to help with the wage supplement piece. So we're really focusing on recruitment and retention, which is one of the reasons I joined the group that I joined through the panel. Yeah, so I wasn't supposed to be on today. However, I was still in office, so I figured I'd jump on one last time before I depart. But yeah, before that, I worked at the state of Kansas for 12 years, and then I worked at TFI. So I've always focused on family and children in my work, and was very passionate about the child care piece when I came on board. So.
Well, we appreciate your voice, Christina, on the panel, and thank you for joining us and being a part of this panel year. I should have prefaced that we are doing introductions because I feel it's very important for those who are joining on live stream to connect and understand the depth of knowledge and local work that comes into joining the panel, and just giving an opportunity to showcase over this last year those who have volunteered, because this is a volunteer appointment to be at the give the Friday mornings once a month to the panel and all of the outside advisory work. I will now segue back to Bethany, because I see Bethany is on. Bethany Samuel.
Hi, good morning. Bethany Samuel. I work for a Department for Children and Families. My position here is Links to Quality Support Specialist. I started out with DCF about 12 years ago, and initially was processing eligibility for things like SNAP, childcare, working with our needy families. And then about 4 years ago, I moved in, or I guess we're coming up on 5 years actually. I moved into the early childhood side of things and started working on this side. And currently, what I'm doing is I work with Links to Quality, which is our state quality improvement system, and it's a wonderful support system for our providers. So check it out. And then also, I do a lot of consumer education, working, trying to get the word out about different opportunities for our families, for our educators, for anybody who is interested in childcare. So that's me.
Thank you, Bethany. And Bethany she has a great footprint in the state on all of our websites that really focus in on early childhood. And so she's also that great guru and go-to if you need to know anything about where you find information on any of our web presence in our state. So always appreciated connecting with you, Bethany, and glad you're part of the panel too. Mandy.
Good morning. Can you guys hear me fine?
Yes,
Okay,
I
wonderful.
can. So
Okay.
thumbs up.
My name is Mandy Law. I am the Early Childhood Connections Program Director here at Child Start. My team and I work with childcare providers in South Central Kansas. We provide coaching, technical assistance, professional development. We work with families and helping them to find childcare. And then we work a lot with community partners on how to raise awareness for childcare and quality childcare. So I always tell people, if there's anything to do with children, I guarantee we have our hands in it.
And part of the Coalition of the Willing, right, Mandy?
That is correct.
Yes. Love that tagline. Okay, anybody else who has, because we have a running list, but who has not been able to introduce themselves, who would like to volunteer during this April 17th session? Melissa Martin. Melissa, you're muted.
I'm always trying not to make extra noise during the meeting. Sorry. I'm Melissa Martin with Sparkwill, and we actually provide services from early childhood through early career. But our focus on early childhood is the newest segment of our services in the last several years. And so our work is currently in Kansas and in Missouri, and we are continuing to expand both within the states and hopefully outside. Being on this panel has been fantastic. I feel like I have been able to contribute, but most importantly, I feel like I've been able, but maybe not most importantly, but for me, I have been able to learn so much and have gotten to meet so many terrific professionals and learned so much from people who have been in the field for a very long time. So we're thrilled to be doing the early childhood work, and our work really focuses on parent supports and developmental assessments and so forth in the early childhood space.
Thank you for volunteering, Melissa, and again, just appreciate you. And I think what a great PR moment for anybody who's listening and would love to be a part of the panel. Our applications are open. There will be information later on, but you really solidify what has been my goal as the chair this year is to make those connections and it be a two-way conversation and really connecting partners across the states, and in addition to enlightening and sharing all the good stuff in the early childhood space. So thank you, Melissa, for that lovely segue, and we will move on to the next piece. Okay, every time we meet, we encourage anybody from, if you're a local partner, if you're a state partner, if you're a parent, to join through our Kansas Open Forum. Share a comment, share an idea, share, push us to be better, share an event that you were really excited about in your community through that open forum. And then we would invite you to meet with us and we would host you on our regular cadence. Unfortunately, we have not had anybody to really take us up on this offer. That is going to be something that I really truly want to elicit more of our locals to be a part of our conversation. So hit up the panel soon, and hopeful anybody who's listening will do that. But this is the space that we hold for that. Did not have anybody, so we will move on to Kansas in the news. So our Kansas in the News segment, really, I have broadened that because we do get a lot of our news through social media. That is a source. Of course, it should always be a verified source, but it's always a great way to share information. And I took this from the All In for Kansas Kids Facebook page. Recently, on April 7th, we hosted through the Children's Cabinet what we called the Early Childhood Workforce Convening. And it was a convening that really bubbled up through the panel's work and other work groups I sit in on. And you will notice I used a photo of two of our panel members. So let's give a shout out to Amy and Kim that we see on this photo. But the objective of this day, why I thought this was the perfect photo, is it really, you can see it in the background, that we wanted to create a place that had shared understanding, strengthen commitment, and explore opportunities within the workforce. So really bringing together partners across the state that we had childcare partners over here and having conversation through our systems improvement team. We had partners through early intervention through our state's ICC. We had home visiting through our state leadership team discussing the workforce and really bringing everybody in a common space to have mutual conversation, because we know that we have only a finite number of interested persons moving into the early childhood space, and they may come in and go and move through different sectors. I think we heard that even with our panel members this morning. You start here and then you move over here and then you go over here. So that's why I love early childhood, because you're not put into one box. And so the early childhood convening was really the beginning conversation of bringing all of those interested parties together. So I wanted to share a few other highlights of that convening, because it really started with the panel. As I shared, it was a multi-sector discussion with some forward-thinking solutions. So you're going to hear that a little bit later with our targeted journey work group. But really, we challenged the participants that day to think outside of the box, to use what we wanted to call a magic wand of some futuristic thinking. And I wanted to give you an idea of who showed up, like who was there that day, because I think it's important that we recognize that we really touched upon lots of the early childhood workforce. So you'll see today through our partners that are joining us that home visiting was there from not just grantees through, we had KCSL there, but we had state staff from KDHE, KSDE, really intersecting and having those good conversations. We had our training partners from Child Care Aware and Concito who provide really good technical assistance and really they're highlighting the career pathways and where we could be. We had KSDE staff who really gave us some really good overviews of what the high school pathway looks like. We had direct service providers from Head Start, Child Start, the YMCA, child care center programs, those who are actually doing the work. And then we had nonprofits. We had those from Task Force, Early Childhood Task Force. So we had a wide gamut of direct service, local, state, really digging into what we could do. We only had 3 hours together, but I want to say we covered a lot. So we also asked for what are our priorities and our key takeaways in a post survey. And I wanted to share some of those priorities while our targeted journey will really dig into some of the solutions that they discussed that day. So some of the key takeaways that the panel and other work groups within the early childhood governance structure could really learn some lessons is that we're broad and there are some fragmented systems together, but because that we are committed as a state to that broader cross-sector representation, that we can see that we are more powerful as a collective. And so that was really interesting, and that bringing everybody together, and that it was not just one work group's need, but that how do we work better together? And then shifting from support to strategy. Where could be some low-hanging fruit issues that we could tackle that would really have some really broader systematic impact. So really excited about all of those. And of course, our priorities are always about elevating and sustaining the workforce, and that we could make them that they are a viable long-term profession, and that they evolve in the state, and that we recognize that we should have opportunities to help them evolve, and that we ourselves are part of that early childhood workforce. And how do we evolve as a state system and local level priorities? And then that we really want to build a coordinated data-driven system, that we just don't want to make assumptions, that we will be doing that through data collection. And we looked at some initial data pieces. We looked at early intervention and where they were missing, where's the workforce? Then looking at how do we really capitalize on the CAPE system over the next year as we have more of our workforce creating profiles, and we're understanding what where our system is, are those within our system are moving. So lots of great next steps, and we will keep you informed. But I really wanted to thank everybody who drove in person to Topeka, participated in the EC workforce convening, and really and wanted to make sure that as a collective we were doing the the best work we can, and acknowledging the challenges that we have within the workforce. So shout out and thank you to everybody who participated. So that being said, talking about the workforce, we are going to have what the home visiting team has shared with me is a coffee talk. I am welcoming the home visiting team, and very excited because I get to be in that space with them and hear about the great work that they're doing and really challenge them like, let's get creative. And how do you want to share and highlight with those that are joining us and with the panel? And they really took me up on that charge. And so that being said, I am going to hand this morning's presentation over to Lisa Williams with the Parents as Teacher program. And she is going to challenge us to get engaged. So I'm just putting out that warning right now that this is going to be a two-way conversation with the panel. And you know me, by April, everybody should know by now that she's going to ask for panel inputs. And if there is silence, we will just start calling on people. So be ready and prepared for that because we really want this to be an interactive presentation with the panel members today. So Lisa, we welcome you and the group that you are bringing with you.
Thank you. Thank you so much. Good morning, and thank you for inviting us to the recommendations panel. I'm Lisa Williams, and it is my pleasure to facilitate this conversation. I'm with the Kansas State Department of Education, and my role is as the program coordinator for the Parents as Teachers program, which is a home visiting program in Kansas. I'm also part of the state home visiting leadership team, but today I have the pleasure of facilitating this discussion about Kansas home visiting. And like Melissa said, we really envision this to be an interactive conversation. We have a lot of information to share, but we've decided that we want to do it in a very conversational format. So as we move through our time together, envision a coffee chat or a fireside chat, whatever you want to call it. But I'm joined by a amazing team of home visiting professionals, and I'm going to introduce them properly here in a moment. Through this conversation, we really hope to tell you about home visiting, what it is and isn't, how families benefit, the challenges and realities for both families and home visiting professionals. Actually, Lindsay, you can go to the next slide. So the next one, please. Yeah, so you can look at this as I'm speaking. What makes home visiting effective? What makes a program effective? And you'll also hear a little bit about what the landscape in Kansas looks like. You're going to hear about some meaningful moments and success stories from our providers. And then we're going to wrap up by gathering your thoughts and input on really strengthening home visiting policy and practice in the state. As I said, our goal is an interactive, engaging conversation. We're going to do our best to clearly paint the picture of home visiting services in Kansas and how home visiting services are one critical part of the early childhood ecosystem for our state. So, Lindsay, go back to the slide that tells our team, our presentation team. There we go. I'm going to take a moment to introduce this amazing presentation team that you're going to hear from. So first we have Ashley Eck. Ashley is with the Beloit Parents as Teachers program and has been in the home visiting profession for nearly 10 years. In 2025, Ashley received the first ever Kansas Parents as Teachers Educator of the Year award given by the Kansas Parents as Teachers Association. Ashley stands out in her profession for many reasons, including her adaptability and commitment to meeting each family's individual needs, her dedication to providing high-quality services, and her creativity in service delivery and community partnerships. So Ashley is one of our team members. Ashley, thank you for being here today. Next, we have Holly Fry. Our colleague Holly Fry is with the Kansas Department of Health and Environment. Holly's been with KDHE for 12 years and has spent the last 2 years in the home visiting space on the maternal and child health team. Holly has had a passion, though she may not have known it, for home visiting since she was a young teen. Holly has younger sisters, and they had a home visitor. And Holly shared that she so loved it when the home visitor came to the house to work with a family and her little sisters. She said she loved it so much that even though she was a teen at the time, she recalls really wanting a home visitor of her own. So, in addition to her professional role, her most important role is as a mother to her 11-year-old son. Holly, thanks for being here. Hillary Kane is our next presentation team member, and Hillary's the executive director for the Kansas Parents as Teachers Association, also known as KPATA. KPATA's role is advocacy for policies that support parents with young children. They really foster professional development opportunities for home visitors, and they provide general support to their home visiting membership to help them deliver high quality services. Leading up to her current role, Hillary was early childhood director for a very large school system, in fact, the largest school system for Kansas, leading all things early childhood, including parents as teachers. Her vast knowledge of early childhood and home visiting makes her a vital resource and partner to support growth and expansion of the home visiting landscape in Kansas. Whenever I want to talk about home visiting, I know exactly who to turn to. I call Hillary. And Hillary, even though she typically has 50 different plates spinning, she drops everything to engage in a conversation with me. So Hillary, thank you for being here today and joining our conversation. Next up is Angie Mendez. Angie is the program coordinator with the USD 233 Olathe Parents as Teachers program. Angie has been in education for over 27 years, with 12 of those years of that career being dedicated to parents as teachers home visiting. Angie is the program supervisor and also directly provides home visiting services to families within their program. This is no small feat to have that dual role. Olathe is a large program with 10 home visiting staff serving nearly 250 families on their caseload at any given time. So what Angie said she appreciates most about home visiting is that it really strengthens families for their future while also building strong communities. Angie, thank you for being here. Tia Perez is also on our panel. Tia is a family support specialist with Healthy Families America in Emporia, Kansas. Tia has been in her role for 3 years, and she's committed to helping the families that she serves be the best parents that they can be. Tia doesn't shy away from working with complex family needs, such as addressing drug and alcohol addiction, navigating the transition of a child being reintegrated into the home, or helping a parent even obtain their driver's license. So according to Tia's supervisor, she goes the extra mile to support families who are trying to make a better life for themselves and their children. And I look forward to hearing more from Tia here in a moment. Virginia Sweetall is a supervisor with the Kansas Children's Service League Healthy Families America program in Wichita, Kansas, with 15 years of experience in home visiting. She began her career as a home visitor, later serving as both a home visitor and an engagement coordinator. And for the past 8 years, she's worked in a supervisory role. Virginia also helped launch a Healthy Families America multi-county state site, and now leads the Wichita team. She's passionate about supporting both families and staff, valuing the opportunity to watch families grow and break those generational cycles that they often see. She also enjoys very much supporting the home visiting staff that she has on her team so that they can best support families and strengthen outcomes for parents and children alike. So I hope that introduction gave you an idea of who you're going to hear from today. This team that we put together to talk to the early childhood recommendations panel has a lot of experience in this field. These are highly trained professionals, and I think they're going to really help paint that clear picture of home visiting in the state. So to provide a very high level context, home visiting matters because parenting, especially in the early years, it can feel like a lot to figure out. And a lot of times parents feel like they're on their own. Home visiting programs step in to make sure that families aren't alone. Parents and caregivers don't have to go anywhere or spend hours searching for the support they want and need. With home visiting, the supports come directly to them. Parents are the child's first and most important teacher, and home visiting supports them in that role. So when a family enrolls in a home visiting program, they're connected with a trained professional, often referred to as a parent educator or family support specialist, who meets with them right in their home, or perhaps in some cases, a location that feels most safe for the families. It's not formal, it's not clinical. It's more like having a knowledgeable, non-judgmental guide in your corner as you navigate pregnancy, a new baby, or the early years of parenting. Home visitors sit with the parent while the child plays, sleeps, or eats. They talk through real life things like safety, sleep, feeding, tantrums, the importance of play, literacy, or developmental milestones. Parent educators and home visiting professionals share simple ways to support a child's learning, like turning everyday moments into opportunities for bonding and brain development. Just as importantly, though, they check in on the parent. They ask how the parent's doing, what they might need, and what's going to make things easier for them. There are times in life that something bigger comes up, like needing childcare, healthcare, food, or other community resources. Home visitors help connect the dots so parents don't have to figure it out alone. At its core, home visiting is about building a relationship. It's consistent, individualized support that meets families where they are, both literally and emotionally, and helps them feel more confident and less alone in raising young children. So that's enough from me. Let's hear from our team. And Lindsay, what I really want to do is just go back. Yes, there we go. I want to invite you as early childhood recommendations panel members just to relax, listen, and engage with our panel members. So let's hear from our team now. In Kansas, we had over 115,000 home visits that are delivered annually. 115,000 home visits annually. Let's start with our parent educators and family support specialists. Ashley and Tia, can you tell us a little bit about what home visiting looks like from your lens as a home visitor? Ashley, let me kick it off with you. Tell us a little bit about home visiting.
Okay, well, for the program I work with, I am with Parents as Teachers. Our program depending on family needs, we meet families in their homes once or twice a month, unless they're a Bright Futures family. Those individuals we meet with once a week. So we provide free, it's a voluntary program. We go in the home with the Parents as Teachers model. We do what we call parent-child interactions. So we have some type of activity that we do together with the parent and the child. And then we have our development-centered parenting piece. So with that, we focus on an area where the parent has a direct impact on the development of their child. So things like sleep, nutrition, safety, something around a topic like that. And then we also focus on a family well-being piece. And in that part, I think that's a great time for us to really connect with the family to see what their needs are. And then we're able to connect them to resources that are available to them that they might not know about, or they just might not know that they qualify for. So we go through each of those 3 segments in a visit. And then really it's about just talking with the parents, really discussing with them what their needs are and how they feel their family well-being is going. And during those conversations, we really are able to, for our next visits, plan visits that really tailor to what our families are needing. So for me, that's kind of what home visiting looks like. I can support families, and then they can have better family well-being and encourage their child's development and hopefully some school readiness. So that's kind of what home visiting looks like for myself.
I love that. Thank you so much for sharing, Ashley.
You're welcome.
Tia, what does home visiting look like from your lens as a provider?
Yeah, so for our home visits, we do a lot of it based off of relationships with the parents, and we create a service plan with them to cater to their needs. We also do multiple screenings, such as mental health, parent relationships, and child developmental screenings. And we do them quite frequently so that we can utilize, based off of the family's needs at that time, what we can bring out and focus on. But with that all being said, no home visit is the same. You never know what you're walking into. So I could have something prepared, but I walk in and the family is dealing with a crisis, and we have to shift and we have to focus and prioritize in that moment on what they're facing.
Yeah, that's great information. Tell us a little bit more about that. So you prepare for the visit, and then you get to the family's home for their visit. What happens then? How does the conversation start with them? And then what's it look like if you do need to pivot? Tia?
I think, yep, you're good. I think a
Yeah.
big part of it is if the parents are able to focus, right? So are we able to engage in whatever curriculum I brought, or do we need to focus on something that is currently happening that they're facing? And it is working with the family. That's a big part of what we do, is having the resources in our community, in our back pocket so that we're ready to help them as best as we can. And a lot of it is, kind of dissecting, what is the most important thing that we need to focus on right now? Is there some food insecurities that we need to focus on? Then we need to make sure that we're able to help the family in the moment to do that.
Yeah, that makes sense. That's complicated. It's a real balance between having a structured plan, because we do offer these evidence-based programs. So having a structured plan, but yet being able to meet the needs of the family. Ashley, did you want to add anything to that?
Yeah, I was just going to mention that for myself, what I found that if you really build those relationships with your families and those connections, just in those first couple minutes, when you arrive and you just ask, how's the family doing, or how have things been since the last visit? I really feel with those families, when they have that connection with you, right when you walk in, they're going to let you know if there's something that they need to talk about or that they need to work on, because they trust you. and you have that relationship, and they feel safe. And so I think that's one of the most rewarding things about my role is when families feel like they can talk to us, and that does shift our plan a little bit, but I think that's really ultimately what we're there for, to provide them with the resources and assistance they need so that they can be better parents for their children.
Yeah,
I
I
have a
love that.
question, Lisa,
Yeah,
for your home visitors.
go for it.
So I appreciate the pivot, right? Because the whole point of home visiting is meeting the family where they're at. So, can you share a little bit with the panel so we have some awareness? Because what I recognize is you are the workforce too. You are the early childhood workforce, and we just had a convening about that. Can you share a little bit of like what your background is and what each of your particular agencies, supervisors, you know, what training, what ongoing continuing education do you receive to be able to pivot in those minutes? I have a social work background, and so this is really fascinating to me because you have to be able to meet families where they're at, and you're an extension of both early childhood and our well-being social welfare side. So you're like the perfect group to really meet those families in those moments. So can you tell us a little bit more about about that ongoing and what you receive as part of the workforce to be able to do the work that you do every day with families? Either
Ashley,
one.
you came off. Yeah, go ahead,
Yeah.
Ashley. You came off mute, so that's
Okay.
right.
Well, I guess for myself, with the Parents as Teachers program, to become a parent educator, you have to be certified. You have to go through a training period. Well, when I started, it's a little different from when I did it almost 10 years ago, but we had two different programs. One that was a week long in person where they trained us. They went over we talked about the curriculum, the different pieces of what a visit looks like. And then we had the opportunity to, build a plan and to do a report. We watched a few actual home visits in person. And so just a lot of training there. And then there's a second piece of that. Because our program serves a birth to age 5, so there's two pieces with that, and then after you're certified, you have to have so many continuing education credit hours, professional development hours, that you have to do. And with that, the KPATA is great. They offer us a variety of trainings throughout the year that we're able to do to continue with our learning. But there are a few that we're required to do every year. So, like we do trainings on intimate partner violence, child abuse and neglect trainings. We usually do some type of training on like substance abuse. So throughout the year, we're able to continue our education by doing certain trainings. And then for myself, we have what we call reflective supervision. So we have that time with our supervisors. And in that time, they provide us with a lot of knowledge and training opportunities. And we just really discuss, new content, new things that are happening in our field. And I'm constantly receiving emails from my supervisor. I think this would be great to share with families. So I just think there's just a lot of supports that we're also given to continue our own education, so that when we go into homes, we do feel like, we are pretty educated, and families feel like the information we're giving them is really something that's backed by research based, and that, we know what we're talking about when we discuss with them things that they can do with their children. So that's kind of my thought process.
No, I appreciate that, Ashley. I really wanted to highlight that for the panel because we've been curious about home visiting, and I think there's a misconception it's about child development, but it's really meeting the family where they're at and having like your toolbox. And so you did a great job of illustrating all of the training that goes into keeping your toolbox up to date. And we see two hands up, so I'm going to let Maritas go first.
Okay.
And she has a question as a panel member. So we're engaging, Lisa. So right where
Yes,
you
you
want it.
are.
So
Go for it.
all
Go
right.
for
So
it.
Maritas.
Well, thank you. Thank you for so much for sharing about home visiting. I know that my nephew, when he was younger, my sister-in-law usually talks to me and was very excited with people coming to our home and work with them. They are home visitors. My question is, how do you get a family connected with home visitors? Or
That's
how
a
do
great,
we?
yeah.
How do we?
Yeah, that's a fabulous question. There are several home visiting program. There are many home visiting programs in the state. We cover, we were looking at this data not long ago, and there is some sort of home visiting program that covers all 105 counties in Kansas. Now, those programs are a little bit different. Some are based on criteria to enter the program, but there are a number that are not. I think the best way, some of the best ways to get engaged with a home visiting program is to look at 1-800-Children. I think that's a resource that you all are maybe familiar with. 1-800-Children is a tool that allows a family to type in their zip code and then see all of the services that are available to them. So I think 1-800-Children is a great way. And then certainly contacting your school district, maybe the local Kansas uh, Children's Service League office, a state agency such as KSDE for parents as teachers. There's lots of ways to figure out what's available in your community.
Thank you.
You bet. Thank you so much for the question, Meredith. I wanted to pull in our program supervisors just to talk a little bit more about the workforce and what they're seeing as you are hiring and finding these amazing parent educators or home visitors for your program. Angie, can I start? I noticed you had your hands up. Can I start with you to talk a little bit about that from your perspective as a program supervisor?
Sure. Can you guys hear me? Okay, I'm in a different space. So, okay, wonderful. I'm with Olathe School District, so Olathe Parents as Teachers program. And so as far, I think every program, as far as parents as teachers, across the state, we all follow the same model for sure. But our services could look a little different. Some programs, maybe only are able to have capacity for servicing birth to 3. Others are birth to age 5. Others are kind of fluid depending on what a wait list might look like and that kind of thing. So for right now, as kind of coming from the supervisory role, what we really looking and answering Melissa's question, a lot of our home visitors are have like either a bachelor's or a master's level of either like social work or psychology or teacher, that kind of thing. So that's a little bit about what our background and training looks like. And then I know too, as far as like connecting with those resources, a lot of them too were looking for local resources for the training. So I go to, being in Johnson County, am lucky to have Safe Home, who we could go to for intimate partner violence training and information. So we have that connection that's super close, and we build confidence in ourselves to be able to then refer our families there. So kind of going off of that training piece. But again, as far as like the supervisory piece of it, I think the big part is really supporting the staff. Because, sometimes it's a different day. Every day is a different day. Every hour is a different hour in this job. So, which is wonderful and amazing because we're meeting each family where they are at. It's not just a cookie cutter approach. So it's very individualized and specified. So a lot of what we're having to do as a coordinator is really supporting the staff. And it might be at 10 o'clock at night. It doesn't happen a lot, but it might be, or it might be at 8 a.m., whatever they're needing. So, and then also a big part for us too is really managing that data. So looking at our screening data, our parent assessment data, if we have a lot of families who are, maybe mental health, we're seeing a lot more of positive screenings for those, like, okay, then our staff, that helps me to know my staff needs more training in mental health, and what are the resources in our community. So that way we can have more and more background knowledge ourselves to be able to then support our families. So as a supervisor, that's a really big piece each year that we're looking at our data, managing that data. And that gives us kind of our plan for each year. So, and then also kind of those connections with community partners. A lot of what I'm doing too as a supervisor is meeting the people who are in our community. So when I think Ashley referred to, we do reflective supervision with every staff member for 2 hours every month. And so when I'm listening to Jenny and I'm listening to Susan, they have different needs for their families. So me being part of the community, and knowing what those different resources are, I can say, Jenny, here's where, to help guide her families to this. And then Susan, we're going to go to this. So that's another real big part, is those community connections for us. And then it also helps us address the needs of our communities, because those are changing constantly, what our communities are needing, and what it looks like. So
Yeah.
that-
Yeah, these are big, robust programs, aren't they? And it does take a lot of intentionality to really support staff so that they can do their job and support the families. So, oh, we're going to talk more about our workforce, and we'll pull in some other panel members, but I want to go back to something. I can't remember if it was Tia or Ashley that was talking about it, but you talked about how important the relationships are in home visiting with your families. Just if you don't mind, tell us a little bit about what that looks like and how you go about building a relationship with your family. Tia, can I go to you first?
Absolutely. Yeah. And I think it's a lot of what everyone said here. It's meeting the family where they're at, and it's finding those connection pieces that you're able to build upon. So for me, I'm a very energetic, spirity person. And sometimes I walk into a home and they're a little bit more shy, and you have to lower yourself. You have to meet them where they're at. You can't go in all wild. There's also just finding common ground, right? So if there's something on the TV, I'll talk to the family about it, or remembering something that happened at the last visit and showing the parents that you remembered and that you care and that you're there for them. It's showing up every single time.
Yeah, that's great. How long does that take? So in the home visiting process, like when you engage with a new family and you're thinking about building that relationship, um, what's a time frame for how long it takes to build the relationship that will then allow you to get to the important work that the family wants to do?
That is a hard question, because I would say it's different for every family, right? If I see that I am having a hard time trying to make a connection with the family, I have to take a step back and look at what could be the possibilities. Is it that they're not comfortable with being in the home environment quite yet? Is there other factors going on where maybe it would be better to meet at a public library? Stuff like that, and try to just see it from the parent's perspective of what we could truly do to try to build that connection.
Yeah, that makes good sense.
So Ashley, we have a, we've spent a lot of time learning about the library system in Kansas, because we have a panel member who's a part of that regional structure, and loves to share some of those highlights. And we have facilities on here, child care centers and whatnot. So how could we be a resource and in those spaces, and understand how we can connect families, and is there anything you do special to connect with the local library system to say, hey, can we work on maybe having a place in our library where we can meet with families? And I even think of some of our larger child care center facilities that might have meeting rooms, or there are things that outside of the box locations that that we should be aware of, that we can foster in our own communities to support home visiting. And I say this as we use the term home, rebranding to be able to use spaces in the community that families feel comfortable with. What can we do from the local level to help foster some of those, and connections that we may have not thought about, to make families more comfortable to engage your services?
Yeah, I think that's great. Actually, we kind of do some of that already with our program. I myself served a family at a library for a while because they just weren't comfortable with us being in the home. And I think that's really important because we don't want to lose families. We don't want to not be able to serve families because of something like they just are uncomfortable with us being in the home. But they were comfortable with coming to us and meeting us somewhere. And while we do hope to get in the home where they spend most of their time, their normal environment, we still want to be able to provide services. So we have partnered with our local library. We also do other things outside of just visits there. So like we do group connections there, which also just encourage families to go to the library and utilize that resource because they have a lot of great resources, a great children's center at our library here locally for myself. And then we've also have had where we've had some visits where we've done them in a child care center
Okay, good.
because that's what worked out. So we try, and lots of times if it's like a twice a month visit, we may try to do one in the home, and then one if it works better for the family at the child care center. And sometimes even the child care the employees, like they also appreciate that information and that support for what they can do while the children are in their care as well too. So there are circumstances where that has happened. And then even for ourselves here, I also had a family where we served here at our office in a space here because that's what worked better for the family. So I definitely think that there are opportunities to engage or to find other places to serve visits. And sometimes you can't be in the home. Like we have a protocol, like with bed bugs. If there are bed bugs in the home, our program cannot serve inside the home until that has been, someone has come in and this has been taken care of. And so a lot of times that means having visits alternative places. So we've done places like the park, places like that where because we are a confidential program, so it still has to be somewhere where we can still maintain our confidentiality when we're doing our services. But definitely thinking outside of the box on places to have visits at.
I appreciate your
Ashley.
adding context. Thank you.
Yeah. Tammy, go ahead.
Thank you, Melissa, for mentioning libraries. We find parents as teachers to be fabulous partners, and almost every library I work with mentions having parents as teachers in as a partner to help them in some way, whether it's with programming or whether or not they're having a family group meeting. Everyone calls that something different, so it's hard to come up with one name that fits all. But I think that got to the heart of it. I will tell you that for us, We often hear, oh, we lost our family educator, okay? But we don't always hear who the new person is. And so it's kind of hard sometimes for libraries to continue that relationship whenever there's some turnover. I would love to have a closer relationship with parents as teachers, that we can have that continuity. So whoever wants to take that on, or if you do want to take that on, I would love to talk to someone about that and see what can we do to make sure that we're being good partners, and reaching out to you in the most effective way. Thank you.
Yeah, I love that, Tammy. Home visiting is one of the programs that is going to move into the newly established Office of Early Childhood. And I think under that umbrella, we're going to have the opportunity to really coordinate all of our programs. Later on in our panel discussion, we're going to talk about the state landscape, but there are, 3 or 4 pretty prevalent home visiting programs in the state. You're hearing from Healthy Families America and parents as teachers, parent educators, and supervisors, but there's also universal programs through maternal and child health that are shorter term programs. But my point being, once we move into the Office of Early Childhood, I think we're going to have more of an opportunity to collaborate, have consistent messaging, and really normalize home visiting services across the state. So I think keeping in touch with our partners is going to be one goal that we'll really focus on. Let's see. Was there, let me turn another hand up. Okay. Let's talk, let's go back to the workforce a little bit. I think that's really important to talk about with this group. I want to pull in a couple of our other program supervisors or people that have had experience with the workforce. So Hillary and Virginia and Angie, these are this is a part of the conversation that I'd love you to join in on in terms of the workforce. Let's talk a little bit more about the home visiting profession and what you're seeing in terms of recruitment and retention for the workforce. Virginia, can I start with you? We haven't heard from you yet.
Sure. I think some of the biggest things that we're seeing is just recently I obtained my master's and I was in the social work program, and I've worked for home visiting for a really long time. And when I would tell them I was in home visiting, they automatically assumed that meant I worked for DCF, not realizing that home visiting is also part of early childhood development and the programs amongst early. So one of the things that I'm seeing is people just aren't, especially the ones that are coming into the workforce, are just not very familiar with home visitation, what that looks like, what that feels like, what that actually means. And so when we have people apply and we're trying to retain and obtain new employees, I know some of the things that we're looking for is that familiarness with early childhood, working with stressors, working with families and parents, but also really working for that, you know, lived experience of maybe going through some things of their own, understanding what crisis and stressors look like, and walking into a home and being able to have empathy and have a family focused, a family centered lens when they go into those homes, non-judgmental. And so when we're hiring, those are the things that we're looking for. And I think on the flip side of that coin, as a supervisor, my job is to retain those employees and provide a safe, stable, consistent supervisor style that allows them to be reflective, have a safe space, be able to process those things to prevent burnout. Because I mean, I love home visitation, but we're not paid like doctors and lawyers. So being able to have that space where they feel safe and they're not burning the candle at both ends, really is so important for the staff in retainment because they walk with families through some of the most difficult times of their lives. So, from that piece of it, the retaining piece of it, we do have reflective supervision. Healthy families, I have to do an hour and a half to 2 hours a week with every single staff person. And then we also have reflective group with our staff with a licensed reflective group facilitator monthly for 2 hours. So we're really trying to put in all those fail safes and all those prevention of burnout and that secondary PTSD. So that's kind of what it looks like from the Healthy Families perspective in the Kansas Children's Service League. We're wanting people who can build relationships and can keep those families and just, in a lot of ways, provide the first healthy and stable relationship that those families have ever had. So,
Yeah, that's great information. That really lets this panel know really the depth that home visiting gets into, and the home visiting profession gets into with families to really support them and get them ready for their journey and to meet their goals. Let's see, Abdul?
Yes, Abdul Yahai with Open Minds. So I am the chair of the Ecosystem Committee, and I was just thinking about how everything is going into we're bringing in things to the Office of Early Childhood. And I wanted to just explore, just kind of throw this out here about broadening our ability to have what I would call home visiting friendly centers. So like maybe licensed centers have a space like Melissa was talking about, where the kiddo or family doesn't have to be at that center, but it is important to do modeling in some of the things you're trying to introduce or help with your families. And so it would be nice if maybe there was a space in each center, licensed center, where there is a possibility, and then that kiddo can also visit in their age group. Uh, like you said, once every other 2 weeks or stuff like that. I'm just really thinking about how we can use the resources, and those centers would have to, the confidentiality that you're referring to, but also just more so using a partnership with state dollars, and the centers that are in our community.
So Abdul,
Excuse me.
totally exciting, right? Because there's an opportunity in the Office of Early Child Care where, as Lisa alluded to, you're bringing together childcare, you're bringing together home visiting, and we're bringing together, taking Bethany, looking at quality and opportunities when she was doing her introduction today and sharing what will be moving forward also under the office, just a different way to provide services to families. And so, like, if there's a gentle takeaway later on today, that would be it, Abdul, is to rethink the delivery system. And what do we have in place? And what can we do to support families in a way that is, as Ashley was alluding to, that is to their comfort level and to their ease, and in a way that doesn't make anybody feel less valued because things might be happening in the house that we're not prepared for maybe at the moment, but you still want to continue your services. So I super love your thought process, Abdul, and
And I want to say
excitement.
it's not to replace nothing. No, my idea is
No,
not to replace, but it's more to have an additional comfort level,
right.
in what we can do as a community.
A different resource. Like we have, we have libraries, we have parks, we have all of that. But how do we add another, like another tool to the home visitors toolkit when they're thinking about that family engagement. Lisa, I think you were going to add to that also, so I will throw it back to you.
Okay, I wanted to just call on my colleague Hillary, as I'm listening to this, there are some emerging practices that I think that we can leverage. Hillary, do you want to take a moment to talk about supporting care providers and what that looks like?
Sure. Good morning. I'm Hillary Kane. I'm the Executive Director for Kansas Parents as Teachers Association. And we have a program that's actually been around for a while in the Kansas City area, but is a new program under Kansas Parents as Teachers Association that is called Supporting Care Providers of Kansas. Supporting care providers is a model that supports family, friend, and neighbor care providers with home visiting services. So if you think about how, childcare obviously is a family's choice, and many of times they might be looking at a grandparent or a family member, a neighbor, a friend that would be caring for a child, then the goal of supporting care providers is to go out and provide home visiting support and curriculum to that provider. So they really are up to date with the most, current practices when we think about safe sleep, when we think about child development, when we think about having a safe environment for the child, and so on. And so they're really modeling parents as teacher services, although they do have a different curriculum that is supported by parents as teachers. They are going out and providing those services to those family, friend, and neighbor providers. And I just wanted to add one quick thing, Lisa, as well. When we think about the workforce, one of the pieces that I think is also really important, in addition to everything that's been shared today, is that we want to be talking to individuals who are our young kids and college students about home visiting. We want to be sharing about home visiting as an important part of the early childhood landscape in Kansas, and that it is an opportunity for a career. So I know for myself, it's been really important to connect with high schools and go out and talk to high school students who maybe are interested in careers in early childhood, also to work with universities to be able to have those conversations and help others to just really, build that knowledge base around what does home visiting mean, and helping them to understand that it is an incredible opportunity as a career. So I just wanted to add that as well.
Thank you so much, Hillary. Desiree.
Hi, Desiree Strait. I am a home child care provider, and I just wanted to continue kind of where Abdul was coming from. Of the child care space does offer additional locations for home visitors. Obviously, each provider is different, but I know for myself personally, I have opened up my program to the families that are here and have given that space for home visiting when they weren't comfortable having them come into their own home initially. So just wanted to make sure that that resource was noted.
Yeah, that's amazing. And I've noticed I've been in this field now for 5 years, and I've noticed that we have started moving away from home visit to personal visit. And I think that's probably a really important distinction. Like our professionals mentioned, it is important to see families in their home environment, which is where they spend most of the time. So when you're talking about safety, parent-child interactions, the things that they're really focused on, eventually it is important to see that interaction in the home. But having safe spaces is just wildly important for both the workforce and the family. Trina?
Trina Morgan with KCSO, and I'm going to preface this with I'm a little biased because I happen to have supervised Virginia for 5 years, and I was part of the hiring supervisory team that hired TS. So I love and appreciate both of them. But one of the things that I would like for them to talk a little bit more about is that work with families that are not just in crisis once, but that are in continual crisis and at huge risk for abuse and neglect. And how is that as a supervisor to supervise? What's that like, Virginia, for you each week? to have those 2 hours and to be hearing that consistently, and the support that you're able to provide, because I think that's something that home visiting doesn't talk enough about.
Thanks, Trina. I would say with Healthy Families America, we were known and have been known to be an intensive home visitation program because we are in their homes more frequently than a lot of other models. And with that comes families who stay in a perpetuated state of chaos and crisis. And so, from the supervisor lens, I'm grateful that we have a setup to where I also have supervision and my supervisor has supervision. And so there's this wonderful like safety net of people that are there to kind of assist and support when one of us gets stuck or overwhelmed. And so for our families who stay in a perpetuated state of chaos, which I would say is probably about 80% of our families that we have right now, and I think it's just increasing due to the things that are going on in the world today. And so those needs and those crises are becoming a little bit more intensive. And so for me and what I do with my staff is I hold a space for them and I'm present for them and remind them of what our scope of practice is. And I remind them of the importance of just showing up and being present. A lot of times there's not much we can do aside from give resources because we're not clinicians, and reminding them that being seen and heard is half the battle and provides a support that they may have not felt or had growing up. And so giving them the opportunity to have that, along with connecting them with those professional clinicians and resources and housing professionals and our DCFs. And truthfully, one of the things that we preach is that DCF is not the enemy. So if we're going into crisis, let's contact them and see, because I always tell them they got more resources in this state than the rest of us. So let's connect with them and see to prevent whatever's happening. So from the supervisor lens, it's a lot of holding space, redirecting, checking in, and also offering our EAP services when things do get really, really tough. So
Thank you so much, Virginia. I think this might be a good time. We clearly did not get to everything that we wanted to get to. This group, our presentation group, and then also the panel, clearly very passionate about home visiting. But we got the nod that we're about 10 minutes from needing to wrap up. And so along the lines of what Trina was talking about, I'd love to wrap up with stories from our home visitors. I know that they've thought of a couple of things that they want to share that speak to the depth of the work that they're doing with families. So let's see, Ashley, can I start with you? I know you've got a couple of really compelling success stories and family complexities that you wanted to talk about.
Yeah, absolutely. I'm going to precurse this with a tears might happen. I tend to get a little emotional when I think back on some of these. So I do have a couple really meaningful moments. And I think what you were just talking about, Virginia, this kind of segues really well into this with families who are in crisis a lot of the time. And I actually had a family, it was a Bright Futures family. So I was seeing them weekly. And mom was really struggling with some mental health things of her own, and that was really impacting the parenting and how the child was being taken care of. And I think this one was just so huge for me because once we ended our year of Bright Futures, so the first 3 months are weekly visits, and then you move to twice a month. And then at the year mark, they can either just stay in the Parents as Teachers program, or you kind of reevaluate from there. And my mom, when we were talking about, because in that year's time, it was just amazing, the progress and all the work she put in. And it was, and I don't think she realized how much she had really worked and improved their family well-being. And when we were discussing it, she just said, I want to thank you for not giving up on me. And so I think that's huge when we have those families who, are in crisis a lot, that we don't give up on them, because a lot of people do. And so that just made the world to me, because in that year's time, I was like, she got mental health services, which was huge, because she had a lot of anxiety. So just doing that alone was huge. And she got a job, and she's maintained that job, which is wonderful. They have reliable transportation now, because they went a year with no vehicle. And the biggest of all, I think, their daughter, she received a autism diagnosis, and they are now receiving supports and services that are helping her tremendously. And I just love it when I get videos from mom. I got one of kiddo telling mom, I love you, for the first time. And that just touched my heart. So I think that one is a really big one. And I had another one with a young girl who needed a hearing aid, and their family would not have found that out probably for a couple of years if, I did our hearing screening, and we failed, and kiddo had been sick. So I said, we're going to try it again in a month. And came back, and kiddo failed again, but she had a sinus infection. So I'm like, okay, we're going to try it again. And then that third one, we failed again. And I was like, I think it's time that we seek some further evaluation, and really encouraged her to take kiddo to the doctor. And at our next visit, mom, I walked in and she cried, and she said, our kiddo needs a hearing aid. And we wouldn't have known that had it not been for your program. So I think that was huge. And, I didn't do anything special. I just did what our protocol for our program was. But I think she thought, she was like, you were really persistent, and you didn't just let it slide or think, oh, she's just sick. That's why we failed the test, and it'll be okay. And but mom was she just really appreciated that. And now kiddo has a hearing aid, and we're in school now, and so they are receiving services in school to support her better. And so that's wonderful. And then I have a couple more that I think the hardest part of being a home visitor sometimes is that we do have to experience some of the family's most difficult times with them, and maybe things that we didn't think we'd ever experience. I had a mom who, during a visit, had to tell me that she was terminally ill and had less than 6 months to live. But I knew that it was really hard. But I knew that I was who she needed at that time. So got her connected to some hospice care, and really talked to her about what she wanted for her children, because she was really worried her children were going to be separated, and she didn't want that. So really worked through that and got her to talk to the right people, so that what she wanted for her family, that they knew that they knew what was important for her. And that was probably the hardest thing of my life to when she passed away. But reflective supervision was huge. My boss, I would not have been able to probably stick with this program after that had my coordinator not been here, because she supported me through every step of that, which was huge. I'm so sorry, I'm getting so emotional. But it was really important. And then just recently, I also had a mom who called me after a domestic violence situation, and she needed help. And I was just truly humbled that she felt our relationship, and that she felt comfortable enough with me that she knew she could call me in her time of need. And I was able to meet her at the police station and help her file the report that was needed, and got her in contact with the DVAC. And so she and her children are safe, and they're safe now. And yeah, those are just some things that I think, when I started this job, I never thought that I would maybe experience those situations, but I wouldn't give them up either. Those are opportunities that I was able to really support some families in some of their hardest times, and it's kind of humbling to know that I was able to provide them some support when they needed it. So
Yeah. Ashley, thank you so much for sharing those stories. The impact that you've had on those families is tremendous. And I know that home visitors across the state have that impact. They're oftentimes the first and maybe the only person that asks how the parents are and what's going on. And the parents have to be well in order to take care of the child. So
absolutely.
we're going to go on to Tia for a couple stories before we wrap up. But I think it's just really important for this panel to understand this workforce and how important they are to the ecosystem. Tia, can I move to you?
Absolutely. Yeah, so if it's okay, I will just share a quick story about a family that I'm currently working with. So we enrolled a couple who were expecting their first child together. Both parents had actually lost custody or had a limited contact with their older children from previous relationships due to drug abuse and were not allowed contact with them at the time of enrollment. Both parents were going through drug treatment programs at enrollment, and the dad was almost ready to graduate from the program. The parents were very excited to meet and raise their child together as sober parents, and it was super important for them to do so. Um, After the baby was born, dad graduated from his drug treatment program. And with mine and dad's support, mom was able to graduate from her drug treatment program as well. I was able to actually write a letter of recommendation for mom to graduate from her program through the progress I had seen mom making, going to all of her drug and alcohol meetings and celebrated their progress and successes with them. During visits with the parents, I supported them learning about infant and early childhood development milestones and how to read and respond appropriately to babies' cues and communication. The parents have both since found stable jobs and have moved into a bigger home from their small apartment. And because both parents have remained sober since graduating from their treatment programs, they've been allowed visits with their older children as well. They are amazing parents to their little girl, and the bond they all share together is evident at every home visit. The parents are both local parent advisory board members for ours and attend tons of our family night events that we get to host. And luckily, this family is set to graduate this spring. And next Thursday, we'll be receiving the parent achievement award through Kansas Children's Service League. And I'm so proud of that.
Yeah, as you should be. What remarkable work you both have shared with the early childhood recommendations panel. And just on behalf of all of us, I want to thank you for your work and thank you for sharing those stories. Like I mentioned, we have so much more that we had on our list to talk about and share. The passion for home visiting is certainly there with the workforce that we have and the support that we have through the state. So we're going to wrap up so that you can get on with your meeting. We're available for questions at any point. I might just share our contact for all of the panel members with Melissa so that she can share it out with the panel in case you had questions or follow-up that you wanted from us. We didn't even get to talk to you about the landscape in Kansas and what it looks like, but that's okay. There's plenty of time for conversation, in future opportunities. So, Melissa, what more can we do for you all today?
Well, first, I just, on behalf of the panel, I really want to thank you for this enlightening conversation and for Ashley and Tia specifically to getting vulnerable with the panel and really highlighting what your day-to-day work means and how it translates to real, real work with families. So I think that in itself was so valuable. Lisa is correct. We were going to transition and ask the panel questions specifically of what more you wanted to know, what surprised you. So what we are going to do is channel that into our work group sessions. And we're going to ask our facilitators in your work groups when you meet today to look at the questions that the home visiting team put together, because as a member myself of the state home visiting leadership team, this is valuable information to shape the work coming forward over the next several years, and really provide a guidepost to the Office of Early Childhood and what that could look like. So really would hope that we will drop these questions, or Lindsay already did, Lindsay's already reading my mind. We're dropping them into a way that you guys will be able to have those in your work groups. And I would ask that everybody take a few minutes this morning in your work groups, and then we will get that back to the state leadership team so that we can process that information. So, feel free to stay on and listen to the rest of the panel meeting. But again, on behalf of the panel, I needed a Kleenex. This was such a great moving, and that's really what it is. It's about internalizing and being moved by the information. So again, as we are always challenged to be better in our state. So thank you, Lisa, for putting together this coffee chat and really home run with the team that you brought to the panel. So thank you all, and really appreciate what we learned today and what we felt today. So that being said, we're going to move right into our work group updates. And so in April, we challenged our work groups to think about what is your work group exploring, and one of them is talking about the workforce. We learned a lot again today about the workforce, which is the home visiting workforce. So really appreciate that information. What are aha moments in your work groups? What were unforeseen barriers as you're getting curious about information that you wanted? And how can your fellow panel members assist you with anything that you're curious and anything that you have been exploring? So that being said, if we can move to the next slide, we're going to just get updates. This is, very, very simple. I didn't want anybody to feel like it had to be a really formal presentation. So we're going to transition to updates, and we're going to start with our ecosystem. So I'm going to throw it to any of the members of the ecosystem who, if you pick somebody who wants to share an update of where you are today.
Abdul Yahaya, Chair of the Ecosystem Committee. We are moving forward with really narrowing down some action items that we want to present. This work group has been very effective and efficient, so we appreciate just the diversity in our group. We are, I would say, like on the tailwind because of everything moving into the Office of Early Childhood. So a lot of the structure and just the push for what we are running into or asking for, we have a lot of support. So really our update is that we hope to provide some meaningful suggestions as we transition a lot of our early childhood functions and community networks into one office. So that's our update.
I appreciate that, Abdul. I actually was in a meeting this week and I said, we need a suggestion box for the Office of Early Childhood. And I think the panel is a great mechanism to provide those thoughtful suggestions. So thank you. We're going to move on to the Family-Friendly Workplaces Work Group.
Hello, it's me again, Bethany Samuel. On behalf of Family Friendly Workplaces, so kind of giving you an update of where we are. Last panel year, we worked a lot exploring what an employer recognition award might look like. And we talked to a lot of other states and did some interviews with them and meetings and research exploring what that looks like in other places, even around the world. I think we looked at Australia has a recognition system, and so this year we brought all of that information with us, and we're then moving forward. And this year we focused more on what's already going on in the state of Kansas and some of the players who have already established a lot of relationships with employers trying to advance family-friendly workplaces, as well as some organizations that are interested in starting to get involved in this work. So that has been really great to see that there's growing interest in this area. So I think maybe that's our aha moment is just that, we've had players that have been involved in this for years, like KCSL, and then there's also ones that are looking to get involved. Something that I would ask the panel is if, along those same lines, if you hear about anyone that is any employers or any organizations that are interested on promoting family-friendly workplaces, connect them with us, let us know. We would, at this point, we really feel like we want to bring all of the players together and have everyone, make referrals to each other, coordinate, reduce duplication where we're able to promote each other's work to really be the most effective in this work. I think it's going to take everybody just working together, teamwork makes the dream work, right? So that's where we're at right now. So if you're aware, maybe somebody's, interested in helping promote family-friendly workplaces, but they don't know where to start, they don't know how to get involved, we would love to connect with them.
So Bethany, I think about the work that Mandy's doing in specifically in the Wichita area. And I know Mandy serves on the mental health work group, but how we could incorporate in what we learned from the business sector and what they're doing for, and I wouldn't even call it a family friendly like space, but initiatives, because that looks very differently. And that's what I think I've learned from your work group. And when we've brought guest speakers in, between K-pop and then the business side that Mandy. So your work group has challenged me to look and provide resources, which is in just to share within the broader panel. So I appreciate that. And we will take up your charge and your requests and get information to Bethany and the Family Friendly Workplace Group. So thank you, Bethany, for asking for some assistance. Let's move to the targeted journey, please.
Good morning. This is Kim Kennedy with Department for Children and Families. My internet is a little unstable this morning, so I'm going to leave my camera off and hope that I don't cut out too much. I think Becca usually gives the updates, but I don't see her on here this morning. So if you are Becca, feel free to jump in, or I'll go ahead and just kind of give a brief update. And honestly, Melissa pretty much said it all with her summary of the early childhood workforce convening. a lot of the things that were addressed during that meeting are things that our work group has been discussing, looking at where there may potentially be some alignment for ensuring that our workforce, particularly the younger workforce that are entering into working in childcare license facilities, just to ensure ways that their the courses that they took or their credentialing will transfer over to childcare licensure. And then just also overall ways that we can address some alignment in areas of the workforce. So if anybody else has anything additional to add, please feel free to jump in.
All right, thank you, Kim, for that update. And then the mental health work group.
Good morning, everyone. This is Megan Cluth with the University of Kansas Center for Public Partnerships and Research. So we had a lot of people out in March, hopefully doing fun things. And so we're going to pick up kind of our conversation from where we left off earlier this year. Everybody in the group completed a survey, and we've been talking a lot about what are the highest needs around training and resources to really be a little bit more precise in what we're talking about mental health supports. We've had a lot of conversations about, which I think this is going to resonate based on the presentation we just heard from the home visiting team. Things like how do we make sure we're supporting our workforce when it comes to burnout and compassion fatigue, secondary trauma, mental health first aid, like how do we help people who, may not be able to step away when they need to take care of their own mental health. There's some real barriers around that. Even healthy conflict resolution and just how do you have healthy, productive relationships with your peers as well as families and kids that you serve. So we did a survey to understand what are the priority areas around that? What would content like for that look like? Is it truly like a training? Is it like a resource guide? We've talked about just, there's no guidebook that can answer questions for every work environment. And so what are the types of tools that we could put out that are a little bit generalized to get good information, but that can be easily adapted to someone's own needs, someone's own style, organizations, the roles that they play. So we'll dig into that survey in a little bit here and kind of figure out what do we feel like is the most critical area for our work. And I'm excited to tie that in with the home visiting conversation as well.
Thank you, Megan. And I was, when those questions, that Lisa, we were unable to get to, and we're going to pose in the work group, I was very much thinking of the mental health group after Ashley and Tia were so vulnerable with us and sharing all of their stories, and how do we keep our workforce supported. And so love that you're going to take that on and bring back hopefully some ideas to share across with our home visiting friends today. So as we appreciate the updates, and as we prepare and wind down the panel year, I really wanted to set the expectations for our June meeting, because that will be our last. We really only have 2 meetings left, and really sad to see it come to an end for this panel year, but really excited about what we've experienced together as a panel for the 25-26 year. It feels weird going across two calendar years when I said that out loud. So, but as we prepare for our end celebration in June, we talk a lot about recommendations because we are the recommendations panel. But recommendations is really just, I really want to describe what the expectation and what we see for the work group session in June. I really want to give you the same creativity I gave the home visiting and challenged with Lisa when we discussed having them come to our panel session. It doesn't have to be a formal recommendation. And it doesn't, it could be, as Abdul described, a suggestion. It could be something that you've learned in your exploration of your work groups. It could be, we have this amazing resource that we found, Bethany's still on my screen, that we found in Australia. And now we just want to show you the website so that you guys can be curious about what we're doing in other countries. And how that can translate to work in Kansas. So really want you to put your, you don't feel like you have to be in one box and you have to put all these slides together to share what you've explored this year. It could be really a share out and a shared resource. So didn't want to put any formal pressure, but we just want to learn what you've learned and what you've experienced over this year in your small groups as you were exploring. So that will be the expectation when we get together in June. So I just really wanted to set that tone and love what you guys have been exploring to date. Lindsay, if we want to move on, and now I'm going to throw it to Lindsay, who is going to share some system updates.
All right, good morning, everyone. Lindsay O'Ryan, KU Center for Public Partnerships and Research. Glad to get to speak with you today. So just have a couple of updates. One is another push for the statewide care and wellness conferences. This is an opportunity for connecting local early childhood care professionals and families in regions across the state. So there are 3 coming up in May and June. Just a note that the event in Olathe is almost at capacity, if not on a wait list, but there is definitely still space in Wichita and Salina, and not to say that you can't sign up to be on the wait list, because you never know. There's always things that come up in life that might create some additional space. So this is a really wonderful event. Hope that you all are able to take advantage if it's convenient for you, or to share with others or anyone else who might be watching the panel meeting today. I'm not sure if anyone was able to participate in the events that happened previously. Do we have anyone who attended previously? Okay, no problem. Well, there's more opportunities. So take a look. There's information available on screen and the registration. So just want to make sure that everyone's aware of those upcoming events. All right. So my next update is, as a reminder, if we think back to January, we were able to share with the panel that the All In for Kansas Kids Strategic Plan Progress Dashboard was launched. So just a reminder about the Progress Dashboard. This is an online dashboard that's a dynamic and evolving home where we can speak to progress towards the goals and actions outlined in the All In for Kansas Kids strategic plan. It does reflect our approach to monitoring progress. And this is I think the great thing about this is that we are gathering information from all over the place, but we're also encouraging organizations and others throughout the state to reach out and share different things that might be a good fit for progress initiatives, data, all of those indicators and markers of progress to be shared here. Yeah, so we are doing quarterly updates. So our April meeting is the date where we're launching our next quarterly update. So what has changed? Let me see. Just want to make sure I have this. So I will do just sort of a quick overview here and then actually, I think I'll do a quick here and then I'll just show the dashboard really quickly to remind everyone that that's there. So every priority page, and there's a couple of them listed up here as examples, has a direct tie to the needs assessment, as well as links to strategic plan goals and actions that tie to the work that is happening in those priority areas. As a reminder, the dashboard does not speak to every single thing that's in the strategic plan, But it does have some key focus areas where we're reporting and sharing information about progress that's happening across the state. In each priority area, we have what we are doing, what we're doing. So this is kind of a narrative description of different initiatives and pieces that are happening across the state. And at the top of each one, which I'm actually going to go back a slide, the top of each one, you'll see different key areas, which will be reflected both in the what we're doing and the how we're doing. So you can track the information. If you want to hear more detail about the narrative, you can see that on the what we're doing page. And on the how we're doing page, you'll see data, data stories and indicators of progress in collections. One other new addition is a bright spots page under each priority, which is where we can highlight different initiatives and things that are happening across the state that maybe don't necessarily have data points attached, but they are important progress that's happening and things that we want to highlight and feature that connect to those priorities. So you'll see a link to the dashboard on the page. You can always find that on the All In for Kansas Kids website. And let me just really quickly pull this up. So this is our dashboard. Again, you can find it, a link to this on the All In for Kansas Kids webpage. The homepage brings you in to give you sort of an overview, quick introduction to the dashboard itself. You can learn about early childhood information and sort of the importance of that, about our ecosystem in Kansas, which I know our panel members are very familiar with. And there's also a few instructions on how to use the dashboard. So if you're just wanting to figure out how to navigate, or this is your first time jumping into the dashboard, you can take a look there. Under each priority area, so collaboration and alignment, this is kind of a little homepage to help you orient to what we'll be talking about and focusing on in this area. Again, what we're doing, we'll have some key pieces here. And then speak to different aspects that are covered. Abdul had mentioned earlier, as well as Melissa, talking about the new Office for Early Childhood. So we've got some information here. And then as a quick example, if we jump over to how we're doing, we can see some additional information and data points that connect to that. So the last piece is bright spots. So you can see different links where if you want to go and find out more information about the initiatives, you can go there as well. Want to grab one more piece at the bottom of every, well, shoot, I thought it was there. Just also want to point out under data and partners, you can see all of the different partners who are contributing information. You can find out about all of those detailed reports and sources of information. And you can also click on collaborate with us if you have feedback or data that you'd like to share or initiatives that you'd like highlighted that you think connect well to the dashboard. You can click on that and it will take you to a quick survey and you can share any information that might be relevant and we'll connect back with you to find out more information. So let me jump back so that we can keep moving forward. Are there any questions or certainly Melissa, if you had any other details that you wanted to highlight, otherwise I'll keep us moving.
I just wanted to share that I love the intentionality that the dashboard team is putting into this. And I had hoped our state, they connected with our state home visiting leadership team on what we would like on the dashboard, and it's being built out. And so, and really highlighting what Lisa and group had shared about the coverage in Kansas and all of the good stories. But it, you know, there's it roll out in January and iterations. And so that is to come, home visiting team. If you're wondering like, oh, where's the home visiting work on here? Went straight to my mind when Lindsay was showing like, oh, let's show the home visiting, and then realize it's still being built out. And that's okay because we want it to be reflective of the work. So just really appreciate making sure that it is there. And for anybody listening and any panel members, definitely the collaborate with us. I cannot stress that enough, that we are only as good as the information that we're sharing as we're looking at monitoring the strategic plan and wherever all of the work that is happening. Even makes me think that even our workforce convening was a form of feedback on the dashboard and what is happening in Pillar 2 and all the work to come. So yeah, please collaborate with us and use that link quite a bit.
Awesome. Thank you. And we do updates every quarter. So we'll be back in July, myself or someone else from the team to share what's new. So a lot of the pieces this time are some new information, but a lot of streamlining since it's our first quarterly update after the launch in January, some streamlining and adjustments to sort of navigation to continue honing in on the best way to present and share information, stories, and data so that it's useful to all of our partners across Kansas as we all collaborate on the early childhood system. So thanks, Melissa, for letting me share.
Okay, two key takeaways from today is, I prepared these last night and in preparation, looking at notes, and I knew this is what would, when the heart of home visiting is home visiting matters because it meets families where they are, literally and figuratively. So and that was just so solidified with the stories today. So really, really appreciate what you are doing for Kansas families. And I know we use the term parents a lot in home visiting, but it's really families because families look very different in Kansas and in communities. And so I really appreciate that you are connecting with families and getting creative in all that you do every day as a workforce and those that are supporting the workforce. And just the time that supervisors are taking for that reflective supervision is not an easy task. So just appreciate all the up and down efforts. And then as we think about the dashboard, the data is a powerful tool and tells a story we struggle to articulate. And you can tell that I even struggled writing that sentence because I need to fix that. So please collaborate and share your story. Use that form so that we can get as much rich information on our dashboard. Those are my two key takeaways, and honestly, home visiting leadership team, I feel like we could share so many stories. Like where do we end and begin with the home visiting page on the All In for Kids monitoring dashboard, because you want to get it all in there. So really excited to see what comes of that. So that being said, I'd like to also take a minute and share something as we come to a close and talk about our application for next year. That those panel members at our previous meeting, we had a PCG consultant group join us to talk about the market rate survey, which is really, really important in Kansas to talk about childcare subsidy. And we did have some volunteers. And I appreciate that. And then I resent out the survey and we got some more information after we got the link working. So thank you to Maritas for saying, hey, Melissa, that link is not working. But really trying to make sure that that information translates to the leadership in our state and understanding what the providers are needing is going to be critical and important. And so those of you who have volunteered and those who still want to volunteer. So, and I had Desiree and Cornelia and Becky volunteering to be a part of that ad hoc group. We will be convening. The market rate consulting firm will be connecting with the systems improvement team next week, and we'll be putting together a wider swath of groups. So if there's still a panel member that is interested in joining that ad hoc group, please let myself or Lindsay know, and we'll get that information over to the PCG consultants. But I just did not want to leave that as a placeholder that remained, you gave your names and now what is happening. So I just wanted to give you that brief summary. And then as Melissa shared earlier, Melissa Martin, I am not talking in third person, that we are accepting panel applications. And they are open until May 4th. We already have a good group of applications coming in. And a lot of new membership. So really excited to see who is applying. And please feel free if you have additional questions. Somebody did meet with me and said, like, what does this, what does commitment look like outside of the regular meeting cadence? And how does this benefit me? I think Melissa did a great job of summarizing that this morning. It's really about making connections and partnerships and exposing panel members to the depth of work that is going on in the early childhood space in Kansas. So welcome all of our home visiting team that was here today. If that is an interest to you, please fill out an application and join us. And those who are interested in current panel members of sticking around for another year with us, please get your applications in also. And to those who have already applied that are current members, thank you. And then let's move to the next meeting. So please remember, and this should be on your calendar, that the next panel meeting is moving to Thursday. So that will be Thursday, May 14th. And then we will have our final meeting on June 26th. We will be hosting a preschool development grantee work in May, really looking at our zones grantees. And I get to meet with them and be in that work weekly. So that will be a really phenomenal presentation of the work that's going on in our state. And we're also going to give you some more time to work as a group. Intentional time in May so that you guys don't always have to meet outside of the panel. And then, of course, we have the Children's Cabinet Trust Fund meeting that took place on April 3rd. So if you did not have a chance to join the board meeting, please go back and look at that. And we also have an upcoming June 5th meeting, which will be in person. So, but it will still be live streamed. So thank you very much for joining. And it's just been it was such a powerful presentation this morning. So a lot to think about. And remember those questions when you do separate into your work groups are in chat to get back to home visiting that we didn't get to visit today. So with that being said, we have officially adjourned our meeting for the day. So thank you all for joining. And if you want to have a few minutes of, just to decompress, Lindsay will open up the work group rooms.